contributed to books such as Looking After Children with Autism and Neurorehabilitation and Social Anxiety Disorder. Today, she is going to talk about hypnotherapy as an adjunct in neurodegenerative and neurological cases. So, Krishnaveni, over to you.
Thank you. Thank you for the lovely introduction. Thank you for the opportunity. I'll be presenting three cases specifically today. As Ms. Nivedita already said, I work with three different setups. One looks after the wellness, one is a part of a neuro rehabilitation setup. So I work along with a big team of professionals, of physiotherapists, occupational therapists, speech therapists, special education, and aquatic. So these three cases are specifically ones that I found very good um, very good progress in the emotional well-being when I introduce hypnotherapy, and that is why I have chosen these three cases. Um, I'll be just starting with my presentation now. So today it is hypnotherapy as an adjunct therapy to neurological disorders and neurodegenerative conditions. Because I work with a team that looks after a neuro rehabilitation, like basically neurological conditions, I got an opportunity to utilize my own psychological studies and other interventions to while working with them. So neurological disorder, it basically is a wide array of conditions which results in dysfunctions in the nervous system, including the brain, spinal, and the peripheral nerves. There are many reasons why it could occur, and it can be seen across lifespan. So the one that happens at the pediatric time period during the developmental is called as the neurodevelopmental conditions. Things that neurological situations or conditions or symptoms that we see in the adulthood is no, it can be referred to as neurological disorders, and the ones that we see during the geriatric, which often such as Alzheimer's or Parkinson's, are referred to as neurodegenerative. Along with that, there are many other neurological disorders. Definitely, this comes under the medical purview. I'm well aware of that. This is just for us to have a basic information. As a psychologist, when we are working with such cases, we should at least know some of these over some of the types at least of neurological conditions, and that is why I've added this as well. There are epileptic disorders, demyelination diseases, cerebrovascular, and neuroinfection diseases as well. My first case that I'm going to be talking about. Before that, I have a research paper which I have referred to before I work with this particular case. This is a topic on hypnosis and suggestion as an intervention for functional neurological disorder. This is a systematic review done by Michael H. Connors in 2024, and where they found out that some of the symptoms have been elevated in especially functional neurological disorder. This is the particular research paper that I referred to while I was planning for my own session with this particular individual. So they had done, and as you can see over here, across the 35 studies, they had done a systematic review, which was two was randomized controlled trials and two was non-randomized trials, and 28 pre and post studies were included in the systematic review, out of which 1584 patients were receiving either intervention as hypnosis or as a suggestion, and they had seen very good resolution in the symptoms, especially in the short term. However, we do not have long-term results on this particular systematic review. Case one is of JMS, initial, an individual from the US. He's 50 years old. He is a construction manager, and he had come with diagnosis of multi-system atrophy type C. This diagnosis was given already to him by his medical professionals. He was referred to me for especially very low self-esteem and Upon his PET scan and MRI scans, they had identified that he has more capacity, especially the physiotherapist. They identified that he has more capacity, but while walking, the chief complaint was that he was falling more towards the right side while standing and sitting. And he had difficulty in walking and weaker hand muscles. He was slow in his activities of daily living, and his speech was low and he had a slurred speech, and his self concept, his idea of himself was very low, that oh, I have this condition, so I am not able to do so much. A lot of I would say, because he read so much online about his condition, which can be a progressive condition, he was quite overwhelmed by all that, and he often used to relate to each and every symptom that he was reading to. He also had erectile and sexual dysfunction from February 2017. He had reported sleep disturbances and a lot of anger outbursts from his wife and other caregivers, his kids as well. So my therapy plan went like this. As a therapist, of course, the first is rapport building and assessment. Overall, I had 10 sessions, you know, with Mr. J, and he had the first initial session, of course, was rapport building, and we have a in-depth evaluation that needs to be done from psychological point of view as well. So I had administered Beck's hopelessness scale, Beck's depression, Hamilton, and Montreal cognitive assessment, which indicated mild cognitive impairment. His mini mental status exam was also done, which was intact. So there was no challenges of dementia that was observed. Clinical anger scale was done, and WUCOL, that is quality of life, brief assessment was done. And as you can see, the domain, so the higher the score, better perceived quality of life about self. So the physical health was 44, psychological health was 44, social relationships was 56, and environmental health was 56. The clinical global impression, as marked by the clinician, was observed to be number 6, severely ill. During the initial sessions, my aim was to work with in a person-centered approach. And what I observed is that he was often referring to himself in a very low outlook towards himself. And because he's not able to do so many things that he used to often do earlier, and that thought used to keep troubling him, which used to trigger his anger and emotions. And he used to often have those thoughts that would also interfere with his sleep. I had once, of course, after psychoeducating and taking assent for hypnotherapy, I had started with breathing awareness and progressive muscular relaxation, which he was very cooperative for and compliant. And he reported feeling very relaxed and having a break from the thoughts that he has been having continuously, the overthinking that he had been experiencing. Based on that, I had also done ego expansion in the ongoing sessions with him. And the inner room technique was also introduced. All the sessions would range anywhere from 45 minutes to about 1 hour, 20 minutes. So I would always start with breathing awareness, go ahead to progressive muscular relaxation, then ego expansion. If it was done, that was done, or else I would go on to inner room technique of the TV, the cassette being put in the TV and played. So that was in work, that was done with him. As part of the homework, progressive muscular relaxation voice recording was given, especially for sleep induction. 6 months had post the follow up after all of that. After 6 months, you can see the Montreal cognitive assessment, which was 25, was showing 30. He was also engaged in other therapies of physiotherapy, occupational therapy, and speech therapy based work. The mini mental status examination was 29, and then post 6 months, it shows 30. Oh, I'm sorry. I apologize for my background sound. The next case is of
let him do his job and we do our job. Please.
Thank you, sir. So the next research paper is on pushing the limit of recovery, hypnotherapy with a stroke patient by John Holroyd and Alexis Hill. Hypnotherapy was used to assist recovery of left arm function following stroke in a 66-old woman. Treatment protocol is it was mentioned in the research. So this is a 2008 study, and they had seen there were improvements in the voluntary motor movements, which was observed in this particular research. And the next of my case is also of a client diagnosed with stroke, 51-year-old, SR initials, and he was an engineer earlier, but he's currently not working because he's paralyzed from the left left side. He had a right stroke, right hemisphere stroke. The chief complaints were incoherence of speech, emotional distress. He was very upset, and there was anger outburst with the caregivers, family members towards the therapist. There was impaired immediate, recent, and remote memory recall. Social test and personal judgment was affected. And there was complaint of headache whenever a cognitive task was given, which was challenging for him. A total of 10 sessions has been done with Mr. S, initials. So we had the initial one was of a rapport building session, and I had carried out assessment of Montreal cognitive assessment scale, which shows my score of 18 for him. Psychoeducation about hypnotherapy and assent for the process was always done with all of them wherever the hypnotherapy was used as, along with the cognitive training. My initial agenda or the therapy plan involved cognitive training with him, where I worked on developing his attention, his scanning strategies, his memory, his recall, because often he would lose track of what we were talking, or he would not be able to identify some item on the page when given. Um, then emotion based, I had worked on recognizing his own emotions and validating them. Mindfulness strategies were used with him. Acceptance circle was was introduced to him. Understanding the control of control circle and how we can accept what we are, where we are right now, and other cognitive training. So all my sessions would start with cognitive training, and then I would notice that towards the end of the session, he was getting very overwhelmed and he used to get very angry and he used to say that, I'm a pauper, or his often his words were that, this session that we are doing is of no use. And this was seen in all the sessions, this physiotherapy session, this OT session, and this speech session as well. So when I asked him, when I took a sense from him if he wants to start with hypnotherapy as a technique to just relax. Once he gave me the assent, I started with relaxation training for him. So a lot of progressive muscular relaxation with visualization was done. Dynamic imagination was done with him, where bow and arrow concept. He's a big believer of Lord Krishna. So I had used the bow and arrow because he was also listening to Mahabharata regularly. So I had used that as a dynamic imagination script. Inner mental tranquility and control room technique was used. Breathing awareness was regularly done in the beginning of all the session, and along with that, cognitive training was done. In the span of 5 sessions from the time I had introduced, the initial 5 sessions had a lot of cognitive based work. What I noticed is that he is more compliant for the therapies. There is reduced headache during the session, and there is reduced anger outburst towards the therapist. So the Montreal cognitive assessment, the initial one was 16, and in 2 months, what I noticed is that there is a score of 18 that he has come to, which is an indication of better compliance and adherence to therapy as well, along with his cognitive improvement. The case presentation, the third one is this particular research paper is by Francesca Vescovelli. It is talking about a complementary therapy for promoting well-being in neurodegenerative disorders. The review of a literature, and this is the particular research paper that I'm referring to over here. So it talks about how hypnosis demonstrates beneficial effects improving patients' physical well-being and quality of life. Hypnosis was also found to promote existential well-being and resilience. This particular case is of somebody named Mr. AH, initials again. He's a 69-year-old male from US. He's an IT professional. His diagnosis was MND ALS. He had just gotten diagnosed recently, so he was able to travel, and he did not lose a lot of his movements. He was not he was ambulatory yet. And the main chief complaint for what I started working with him was difficulty sleeping, and he was experiencing physical pain. Um, so the initial, I had done a total of 5 sessions, again, rapport building and assessment, and Bucol was administered, where you can see the physical health has 50 as a score, psychological health as 81, social relationship 75, and environmental health as 75. The score is between 0 to 100 in Bucol. It indicates how well you're perceiving your life. More the score, the better perception of your own life. The clinical global impression was rated to be 4. I done relaxation training with him, breathing awareness and progressive muscular relaxation. And post practice of that, I'd also introduced ice melting pain management techniques with giving all the disclaimer that he should not completely melt away the ice, keeping that in mind. What I had noticed in this particular case is that uh, I done a subjective unit of distress, like how much pain are you experiencing in the beginning, which was 7. And after the ice melting pain management technique, he had given a score of 4. After a physiotherapy, before the physiotherapy session, on one particular day of the session, and then the next session after the physiotherapy session, when I met him for a psychological session, he had reported 8 as his pain experience, and after pain ice melting pain management, he had reported it as 4. Um, there is no follow up for this particular case as of yet to do the follow up. These are the 3 major cases that I wanted to present today. If anybody has any question.
If anyone is having questions, please ask.
Very
Hello, ma'am. I
Yeah.
think it was
Yeah.
very lucid presentation for us to understand the steps of therapy, how to use. I recently completed PGDCH just this year.
Okay.
One
Mm.
question I wanted to understand, what is ego expansion that you spoke about?
So ego expansion is basically working on developing our own inner concept of self, right? So when you're doing the course, you must have come across Mr. Dr. Madhu, that first is especially when somebody is not very accepting of newer suggestions. When we work on ego expansion, it becomes all the more easier for us to open them up to newer suggestions and newer forms of their self, evaluation of their self as well. So ego expansion has many different techniques. One particular one is about the you must have, if when you have done the course, you must have seen the white light entering your body, and then it's kind of cleansing you, as well as you're opening up to newer experiences. So
Right.
that is ego expansion technique that I'm referring to over here.
Okay. Okay, ma'am.
It is expansion of the ego boundary
Okay.
in that sense, but without going into the spiritual discussion, just suggesting that expansion.
So is it equivalent to ego purification that we talk?
Yeah, yeah,
Yes.
equivalent to ego purification.
Okay. Okay. Because
Palan sir,
all of these
uh,
terms are pretty new, so just getting a hold of them.
Palan sir,
Yeah. Does it mean that purification is only about that aham atma asmi, and when we say spiritual expansion and spiritual ego expansion, that is aham brahma asmi. But here in this therapeutic modality, we are just asking the person uh, to become more inclusive
Yeah.
of the surrounding. So this can be a clear distinction.
Yeah, yeah, kind of inclusive expansion of the ego boundary. The person we expect it to become more inclusive. Can say like that. Yeah. Acceptance. It enhances acceptance of others. Um,
So
uh,
in these three cases, the challenge was also their difficulty with accepting their diagnosis. That was leading to a lot of distress for themselves. And you have to understand MND being a progressive condition. MND is, first of all, so rare. Often, individual with MND, they have to lead a wheelchair-bound life. So, when they come to know that they have been diagnosed with it, they become very taken aback, and it becomes such a big challenge for them to accept that condition. And even stroke is so restrictive in their everyday living. And that trophy case also, you have to understand, suddenly there is a change in the way that he's doing things, and so all these can really affect their everything that they know of their life gets shaken apart, and they become very it becomes a very challenging emotion for them to deal with in that situation.
yes, the
So ego
condition.
expansion definitely.
Mm.
Yes, sir.
This
Yeah, sorry, sir.
condition is really very challenging. One of my close friends, many years back, passed through that in he passed away. It's a progressive disorder leading to death ultimately, motor neuron disease. But I've seen it. I have seen that progress of MND very closely. He was a very good friend. So day to day, the deterioration of various functions, it is really very challenging for the patient and for the family members also to accept that.
MND is usually, sir, missed out by GPs. So, like, because most of the patient just complains of weakness, and GPs will take it very lightly. It's just weakness, so just take multivitamin, and that's how an MND is just not diagnosed unless they go to some really good MD physician.
On neurology.
Yeah.
Neurology.
Okay.
Yes.
So it was really good presentation, Krishnadi, and I'm happy with the kind of work which you are doing. Dr. Dayal, I would wish your comments, please.
Yeah, it's wonderful because these are areas where hypnosis has great use and unfortunately not being used. The whole area of psychogenic illnesses, neurological illnesses, conversion disorders, functional neurological disorders, where neurologists have nothing much to offer because these are functional psychological conditions. And even in the organic neurological disorders like Parkinson's, dementia, hypnosis is very useful. And in MND, I found that if there's hope and there's positive, like will to live, it seems, I'm not saying that it does, but it seems like Stephen Hawking lived many, many years after his diagnosis. I think, maybe 30, 40 years. He even fell in love with another woman, married her, all those kind of things. He had two wives, and I'm not sure about children. So you should read his. I don't know if you've heard of Stephen Hawking, but he was a mathematician, very well known. Wrote a book called The Brief History of Time. So I think building, providing support, providing self-help skills, all that is great. So I'm really glad that people are starting to make that big name.
Right. Yeah. It's
Thank
very satisfying and happy moment for Dr. Dayal, me, and all of our age people, because we never thought that these many students will take up hypnotherapy. So it's very pleasant moment seeing all of you doing so much of good work. Uh, thank you, Dr. Dayal.
Thank you.
Dr. Chandanam,
Yeah,
you
sir.
will complete.
Yeah, yes, sir. Yes, sir. At the outset, I want to congratulate Krishnamani Madam. You have done a wonderful, research. Really, it's a good presentation. I have only one question. All these patients, since they are having a cognitive impairment, what are the challenges you have faced while you are giving this breathing awareness as well as this progressive muscular relaxation therapy? What are the challenges? Whether really they understood the procedure? What are the challenges you have undergone?
So in the case of MND, there was no cognitive impairment.
Yeah.
So that was there was no challenge there. He was with me throughout. He was able to work with me. In the case of atrophy, the atrophy case, the cognitive impairment was related to delayed recall. So the
Okay.
Montreal Cognitive Assessment has multiple subsets in them. So the cognitive assessment that when I mentioned it over there, it was referring to the delayed recall challenges that he was having. So because in the script there is nothing that has to have a lot of delayed recall. There also there was not much challenges. In the stroke patient, there was the initial 2 sessions. He was not able to stay with me. He would sleep off and he would wake up much later. That those challenges did happen. However, but he did report in the next session that, oh no, it was very nice, relaxing. So he himself started asking for those sessions. Okay, let's do relaxation. So I used to start with the cognitive work with him in the initial time, and he used to get very overwhelmed because he was finding it difficult to do it with me. Then after about half an hour or so, he would be like, let's do relaxation. Of course, his speech is not very coherent, so sometimes I have to really make out what he's saying, but he does ask for relaxation relaxation in the session by himself. So I'm assuming that he's understanding what I'm doing, and the speech therapist, the physiotherapist, and the wife as well has reported better mood from the time I have introduced hypnotherapy.
Good. Very good.
Yeah.
Good. Thank you. Thank you. Thank you very much. Yeah.
Thank you.
Dr. Shantanam,
Sir.
yeah, thank you. I have found people having upper motor kind of paralysis,
Sir.
where there is rigidity is one of the symptoms.
Okay. Okay.
There, introducing relaxation becomes difficult because their muscles are so tight and rigid.
Yeah.
So there it becomes a challenge, and we need to sometimes avoid that altogether because
Okay.
they can't relax it.
Sir.
But other parts of the body which are not involved in the disorder, they can be relaxed. That like when you ask for the challenge,
Yes.
was the thought.
Okay. Thank you, sir. Thank you very much.
Anybody else would like to ask anything to Krishnaveri or comment something?
In fact, sir, I realized that he has a left paralysis, the stroke patient. And the physiotherapist has told me this last week that he's starting to get some movements. Now I do not know whether it is attributed to this, or of course they are also doing a wonderful job of they do everyday physiotherapy with him. But she's saying that he has the capacity to move it if he wants to, but he forgets to move his left side because he's been not using the left side of the body for about 2 months. So so she was asking me if I can introduce something more in my sessions. So I'm still researching on that.
Good.
Any suggestions, sir?
Yeah. See, you can expect some improvement if the lesion is not very old. It is like if the client you are treating is having this issue for a few days or a few weeks, you can always expect the motor function or the sensory function to revert back, and we can aid those kind of suggestions. But if it is an older case, some few months have passed, 6 months, 8 months, then we don't expect that recovery.
Yeah.
So,
Sir, can I add something?
please.
So one of the cases among the 5 cases that we presented in exams, everyone was having this assignment of 5 cases. So
Right.
one case which I had mentioned was about the paralysis, left side paralysis, and I introduced hypnotherapy almost after 1 year and 10 months, and patient was still then not able to have any walking movements. He was having a power of 1/6, but nothing much than that. I mean, there were just flicker of movements. But after introducing hypnotherapy in 2 months, I have that patient very next door of my house. If possible, I'll take a video and send. He's taking baby steps now.
Oh,
That was one of the major success of my life, I would say. And I immediately told to
Amazing.
Baljit ma'am, because Baljit ma'am had told that, this
yes.
patient doesn't know that his brain is not working. With imagination, if you introduce this, and if does this, then it can create miracles. So I have seen this. It does. And if introduced early, I would say, yeah, then complete recovery can be done.
Yes. Here he can, it maybe sometimes rarely happens, but we need to check also that whether, because this kind of complaints of paresis or hemiplegia or paraplegia for 1 to 3 years, it sometimes turns out to be not a neurological problem, but it is the kind of what is known as conversion reaction, conversion symptom. So my first case, which I treated when I started the hypnotherapy clinic in government hospital, was paraplegia for last 1.5 years. And one neurosurgeon suggested for spine surgery also, which they could not undergo because they were not affording. So, but then it turned out to be psychogenic. And in the very first session, the patient came in wheelchair. He was on wheelchair for 1.5 years, but he went back walking. So this kind of miracle can happen with not neurological condition, but yes, sometimes with this psychogenic paralysis, this conversion reaction, it can give rise to this kind of miraculous outcome. Where we understand, so when we, of course, for relatives and all of them, it is a miracle, but we need to understand that we have not cured some neurological. It was lifting up of some conflict which happened, or some healing took place. That can happen in psyche. Okay. Any other comments or questions?
Yeah, I'd like to say something. One is you can build motivation. Patients who are hopeless and feel there's no hope for something. The other thing is with stroke patients, I found there's something called constraint induced movement therapy, where you tap the hand which is not paralyzed and get the patient to start using his or her stroke affected. So in hypnosis also, I would suggest the same thing, to remember not to use their, to first try with their, and to imagine that also, when that they're using that hand, that movements are returning, all that. So the main thing that I found useful was motivating people.
Motivation definitely is required, and it works, it helps. And we need to motivate the person for doing physiotherapy, because they are not cooperating to physiotherapists generally. After the introduction of hypnotherapy, they become gradually more cooperative to physiotherapy. There also we can contribute.
Yes,
You
sir.
know,
Adherence to therapy.
Right.
yeah, and also the
Veena?
pain. When if there's plasticity, there's pain also when they do physiotherapy. So, or if the hand has been immobile for a long time, the joints also get what do you call it? They get stiff. If
Steve,
yeah.
that is true. Veena, you have any comment?
Yes, sir. Good evening, everyone. Usually, cases like this with MNDP, they also have a premorbid history of depression, major depression, which remains undiagnosed, uh, without suicidality, but very negative experiences, traumatic past experiences. So that's where hypnotherapy has major applicability. So congratulations, wonderful treatment of these cases.
Thank you. Thank you.
So there is in comments, there is one request.
Please read it out.
Nivedita, madam, please.
So,
Ms.
Shikha,
Shikha,
Shikha, hello.
Madam, you can read it.
Okay, I'll read it.
adding on to what Dr. Veena just said, so actually the case of MND that I worked within is when we were talking about stressors in life, one thing that he did share with me, with his consent, I'm sharing, that he's a 9/11 survivor. Yeah, the US. So he was in the building, the Twin Towers. He used to work there, and he was in the building when the attack took place. So he did share that. So when Dr. Veena just told me that I remember the stressor, because I often ask them, are there any major stressors that you have experienced in your life? And this was one experience he shared with me. So he was telling that, I have gone through so much in life, I've seen so much adversity, but this one I'm not able to cope with, is what he did share in the session with us. Yeah.
Yeah, I think Shikha is on. Shikha?
Yes, thank you
Yeah,
so much,
yeah.
ma'am. It is a wonderful session that we had the opportunity to be part of. I have a female who is aged 60 years, and she had suffered damage to her ureter approximately 25 years back during a procedure, and she did not know until later, and when she started having kidney problems, and the doctors diagnosed that probably she had a kidney that had shrunk either by birth or over the years. And it was only recently found out that it was a damage to the kidney ureter. Now, so she is now facing problems. She is also a patient of rheumatoid arthritis. So I have been trying to do breathing awareness starting with that, but I have not been able to make too much breakthrough because she doesn't believe in hypnotherapy at all. So what should I do?
Sometimes if you feel that this kind of therapy will work, don't tell it's hypnotherapy. You tell I'm teaching you relaxation. Known as relaxation therapy also.
Yes, sir.
Okay. So
Yes,
tell it some relaxation. And some people are impressed by the word meditation. I'm going to teach you meditation. No? So
sir.
one can say that maybe no problem. I believe so.
The other question is that according to the doctors, this is a irreversible condition.
Yes.
So, which technique would be best suitable for her?
Who systematically, as we have learned, Shikha,
Okay,
breathing
sir.
awareness, PMR, then teach some
In
imagery, ego strengthening, and by then you will come to know about the stresses. So keep on working with whatever stresses are there in the life,
yes, sir.
and then generally I discuss with the treating physician or neurologist or whosoever is
Nephrologist.
yes, so specialist, and I ask about the prognosis.
Okay, sir.
So if they say that it is irreversible and no hope and all, so instead of giving hope, too much hope, I work on accepting. Like okay, like accepting whatever is there and utilizing whatever normal functioning the person is able to do. So, but that is really very tricky to decide when not to enhance the hope and go on to the approach of acceptance. It happens in seriously ill patients also. That we need to then accepting the termination of life.
Yes, sir.
So when to go on to that is really very difficult to decide. But in liaison with treating physicians, we can judge it.
Okay, sir. Yes, sir. Thank you so much, sir.
Well, okay, so here we end. Nivedita, there are no other comments. Nothing. Huh?
Yes.
Good.
Yeah.
And Nivedita, in your all this announcement circular, you motivate people to join with larger number. So कुछ ना कुछ लिखो के अंदर.
Yes.
We
I'll
expect
do
you.
Yes, sir, I'll do that.
Let us. We want more participants to join.
Yes, sir, I'll do
Good
that.
learning experience for all of us.
Yes,
So
absolutely.
thank you, Dr. Dayal. Thank you, Dr. Santanam.
Thank you, sir.
and,
Thank you very much, sir. Thank you.
all of you. Thank you.
Thank you for all. Thank you. Thank you very much.
Thank you, Krishna
Thank
Beni.
you.
It was really,
Thank you.
really a very nice presentation. We all learned a lot from you, and we look forward to meet you again with more cases. Thank you once again. Thank you.
Thank you.
Thank you so
Thank you
much.
for the opportunity.
All the best. All the best. To all.
Thank you. Good night.
Good night. Good night.
Bye, sir.